Hello and welcome everyone to our first Emerging Technology Committee meeting. Thanks so much for joining us. Um, we are going to get started. As others join us, they can follow along. As a reminder, this meeting is being live streamed on KHI's YouTube channel, and it will be available following the meeting on the Rural Health Transformation website through the Care Collaborative Association. Today, we are going to be doing our kickoff, getting to know each other, and starting to develop our charter. I am Sheena Schmidt. I'm a senior analyst and strategy team leader at the Kansas Health Institute and fortunate to be the lead facilitator and coordinator for KHI on this effort. Thank you so much for joining us today. Excited to get started. For those of you that aren't familiar with our organization, we are a nonprofit, nonpartisan educational institution based in Topeka. We were established in 1995 with a multi-year grant from the Kansas Health Foundation. We're committing to keeping meaningful conversations like the one we're here to discuss today on tough topics related to health. So we are really looking forward to today's discussion. Before we get started, we ask that you can use the chat or the Q&A feature to ask questions. Feel free to use both. We'll monitor along the way, whatever you're comfortable with. The session is being recorded for technical and content purposes and follow-up purposes. And again, it's being live streamed. If you have any technical questions, please find Carson DeWeese, KHI IT Help in the participants list, and she can reach out and help troubleshoot any issues that you have. All right, so we are going to have a packed agenda today. We'll do welcome and introductions. We all need to get to know each other, so we have plenty of time to do that. Then we will provide some background on the Emerging Technology Committee and where it fits within the overall RHTP plan. And then we will also discuss why we're here, our goals and the timeline for our activities together. Then we will transition to developing the charter, and my colleague Wyatt Beckman will lead us through that exercise. It's a necessary thing that we need to get done so that we all are on the same page about the work group, its structure, and how we're going to move forward together on our activities. Then we'll have some time. We have a survey that we've developed to take that helps us as facilitators understand who we have in the work group, gets other details from you like contact information in addition to a few questions that will help us as we're planning our next few meetings. And then we have some time for questions and next steps. All right, so we like to just do a general group agreements. We ask for these meetings that you be present, be open and engaged, and to the extent possible, avoid multitasking. We know that that sometimes is necessary. If you do need to step away, that's no issue. But we do ask you to be present if possible. We also encourage active listening, creating space for new perspectives, and also taking that space to provide your perspective. So we're really looking forward to having these conversations and hope that everyone can have productive and meaningful conversations. So, what are we here to do today together? We're here to support the Kansas Rural Health Transformation Program in harnessing data and technology to transform rural health in Kansas. We'll be also advising artificial intelligence and consumer-facing technology activities implemented under the program. We will also we will develop together as a group our Emerging Technology Committee priorities and work plan and budget for year 2 of the group. And we will advise and support BioSTL, who you will meet and hear from a little bit later, on emerging technology activities, use cases, and ambient AI RFP efforts. So we have quite a bit on our plate to get done throughout the first year of this grant, which runs through October. So let's get acquainted with one another. I invite you all to kind of come off mute, to share your name, your role in organization, the connection that you have to rural health and especially rural health to Kansas, and what you're most looking forward to as an ETC member. And I think if you're not a member, will also introduce yourself and share your connection to rural health and your role on this meeting. So I will go ahead and kind of kick it over to the first person I see, and we'll just kind of run through. So I'll call out classroom style, and we'll see how this works. All right, so I'm going to turn it over to Cindy Samuelson with the Kansas Hospital Association. Welcome, Cindy.
Good morning. Thanks for having me. I'm Cindy Samuelson. As you mentioned, I've been with the Kansas Hospital Association almost 25 years. We represent all 124 community hospitals and other healthcare organizations in the state of Kansas, many of them rural. I am our senior vice president, and Chad Austin is our president and CEO. And at times he may be serving in this capacity, but between the two of us, we are excited to be a part of this work for all in Kansas, not just the hospital sector. So thank you for having us.
Thanks so much, Cindy. Appreciate it. Welcome. I'll turn it over to Scott Roletter.
Morning. My name is Scott Roletter. I'm the Chief Technology Officer with Great Plains Health Alliance. We're a hospital management company primarily. However, we also offer data center services to about 30 hospitals throughout Kansas and Nebraska. Primarily, Kansas is the majority of our hospitals. My relationship with rural healthcare is I've been involved with rural healthcare for about 30 plus years, over 30 years, as originally with HaysMed for a number of years and supported the Critical Access Network and all the wide area network with the technology initiatives we had going on there. Rural healthcare has always been very near and dear to my heart, and just trying to find ways to make the care delivered of higher quality and being able to deliver it more efficiently because of the lack of resources in these small communities. So that's kind of why I'm here.
Thanks so much, Scott. I appreciate your attendance. Terry Kennedy with Community Care.
Good morning, everyone. Terry Kennedy. I am the director. I've got a frogs. Hold on a second. Okay. I haven't talked much this morning yet. I'm the director of the Health Center Controlled Network program here at Community Care. Community Care is the primary care association for the state of Kansas, and our members are what used to be termed the safety net, so federally qualified health centers and primary care clinics, dental clinics who serve the underserved. My primary role here, which I've been here almost 11 years, is to facilitate and manage the HCCM program, which is very much technology based. It's all around technology, data, and value-based care. I'm also involved in our clinically integrated network, and that has a lot of technology in it as well. So I look forward to being on this committee and to, I guess, trying to figure out what emerging technologies we get for our rural providers. Thanks.
Thanks so much, Terry. Kyle Kessler, I'll turn it over to you.
Thank you. Thank you, Sheena, and good morning. I'm Kyle Kessler, Executive Director at the Association of Community Mental Health Centers of Kansas, and we represent all 25 licensed community mental health centers and certified CCBHCs as well now. And in fact, 28 out of 25 of our members have some rural or frontier presence in the state. And so, and I grew up in small towns, and so even seeing how healthcare is impacted and with technology especially was of specific interest to me with this group. And really what we saw during the pandemic was really fascinating in a lot of ways because of how many rural and frontier areas use technology and telehealth at that point in time. They were actually doing a lot of the mentoring or tutoring of our urban areas, which before that, it was drive 30 minutes for your appointment or 20 minutes for your appointment. And then when the pandemic hit, then they needed to start thinking more about technology and telehealth and things like that. But really look forward to the conversations that this group will have in AI specifically and how that impacts things.
Thanks so much, Kyle. I'll turn it over to Dick Flanagan.
Hi, everybody. Good morning. I lead Digital Health KC, and you'll meet my colleague as well, Liz. I'm a 45-year technology person and 35 years in healthcare, most of that with Cerner here in the Kansas City area. Digital Health KC is really at the front end of the innovation and entrepreneurial side of the healthcare IT market. And so we're very focused on finding, growing, and adapting those companies into the broad marketplace. And we made a specific turn last year to address the unmet needs within rural healthcare. So we put together a bunch of ideas. We're not unique in that. Other organizations, BioSTL and lots of others, but we are really looking for ways that companies that compete in the health IT digital health space can pare down in terms of cost and complexity of being able to enter the rural health networks, and also to help those companies understand the needs in rural health that are quite different than in urban and metropolitan markets. So I'll run lots of programs. I'll let Liz fill in some gaps there as well, but appreciate the opportunity. Thanks for including us and some of the technology folks directly. We appreciate it.
Thank you so much. Welcome. I will turn it over to Alan Wamser. Welcome, Alan. Wamser. Sorry about that.
You're good. You're good. I'm the director of cybersecurity infrastructure at Hayes Medical Center, and also responsible for our AI initiatives and any development efforts. I think, for me, I'm excited. I think we're at a really interesting place with where AI is and this grant. So I'm excited to see where we come out of this with some new programs for rural health. I grew up in small town America, so on the eastern side of the state, but ended up moving over to the western side of the state for college, and ended up staying here. So excited to be a part of the group.
Thanks so much. Welcome. Aaron Wooten, you're up.
Yeah, hi everyone. I apologize. I'm working from a conference today, so I'll keep my phone for the most part off camera. But I'm really looking forward to being a part of this group. I represent Stormont Vale, and Stormont Vale is in Topeka, Kansas, but we also serve a number of the different counties in Kansas and are an anchor institution for many of the rural cause in the area. So looking forward to working with all of you to make use of technology and solve some of the problems that rural communities and rural hospitals have. So thank you, and nice meeting everyone.
Thanks, Aaron. I'll turn it over to Alicia Herman. Welcome, Alicia.
Hello, just want to make sure you can hear me.
I can hear you great.
Okay, great. Alicia Herman, I'm the CEO at Edwards County Medical Center in Kinsley, in the western side of the state. Been here for 17 years, and my background is IT. I was a CIO IT director for most of those years. Born and raised rural, so really looking forward to this group, seeing how we can continue to help the rural community.
Thank you so much, Alicia. All right, I'll turn it over to Chris Harper.
Yeah, sorry, I'm going to turn on my camera. I'm in my car, but in transit. But good morning. I'm very honored to be on this committee with all the distinguished folks and former colleagues, and I see a lot of friends on the call, so just honored to be here. I'm a CIO for the University of Kansas Health System and the Medical Center, and then I 2 years ago co-founded our AI Research Center for all of KU, so not just health and medicine, but all of School of Engineering and School of Energy and so forth. And so, I'm a Kansan through and through. I grew up in Leavenworth, Kansas. I'm a military brat, so I grew up in Leavenworth, and then my folks decided to retire in a small town in middle of Kansas called Buhler. And so, got to know small communities very well. Love the openness and the real needs of the rural population from a healthcare perspective. And so I'm just honored to be here and looking forward to working with everybody.
Thank you so much, Chris. Thanks for joining. All right. We're getting there. All right, I'll turn it over to Dr. Gauss. I hope I'm saying your name correctly.
Hey, yeah, it's Gauls.
Gauze.
Thank you.
Sorry
Yeah,
about that.
no worries at all.
Welcome.
It happens 100 times a day, so it's totally fine. So yeah, Nathan Gauls. I jumped on late, so I assume we're just doing quick introductions. Is that
Quick
the theme?
introduction.
Okay.
Yes.
So I am fortunate to be able to work with Dick and Liz at Digital Health KC on the board. I guess I'm a founding board member. I've been there since the beginning. So excited about this work. Excited about this initiative. I think where I am able to bring some value. I'm a practicing orthopedic surgeon, as well as chief population health officer for University Health, and so have initiatives that affect both the rural care that we provide as well as the inner core that we provide. And then prior to that, I was CMIO and CIO in Iowa, where I practiced rural medicine for about a decade or so, and so have a vested interest in everything that we're doing here and everything that we're talking about. So excited to be here and appreciate the invitation.
Thank you so much for joining. We really appreciate you. All right. I see Liz is also on the call. I should have called you after your colleague, but Liz Schaefer with Digital Health KC.
That's okay. Better late than never. I'm Liz Schaefer. I'm the program director at Digital Health KC, and I won't repeat everything Dick said, but we are a nonprofit. We do care about the digital health ecosystem here in the region and how we can improve healthcare for all, especially as that relates to the intersection of health and IT. And at the same time, trying to bring about a win-win, which is obviously the improved healthcare, but also investing in growing companies that are here and located in the region, which good for companies, but also good for us as a region. Like a lot of you have mentioned already, I also grew up in a rural community in rural Missouri. And so I remember firsthand exactly how important it is to have a hospital in your community and what it's like if that system is not functioning very well. So I care deeply about rural health. Anyways, and thank you, Sheena, for having me, and I look forward to getting to know everyone better.
Thank you so much. All right, I think up next would be Robert.
How about I unmute first? How about that?
Sounds good.
I'm Robert Fireherm, the Director of IS at Newman Regional Health here in Emporia. I've been here about 2.5 years. Previous to that, I spent about 6 years at another critical access hospital in Nebraska. And then before that, had a couple years in IT and behavioral health. So just excited to talk with everybody and kind of see what everybody's seeing in terms of new technologies, and AI is obviously a big thing. So definitely want to see how that's integrating with healthcare and what other people are experiencing, and just lots of cool things that I see, and hoping to get feedback from other people about what their opinions are on the same kind of tech. So
thank you so much. Thanks for joining. And then I see Sarah Good on the line. Please introduce yourself, Sarah.
Hi, I am Sarah Good. I'm the CEO of KFMC Health Improvement Partners. We are a not-for-profit consulting organization based out of Topeka. We do a lot of work to support health improvement on behalf of state agencies, Medicare, Medicaid, and CMS. And most of that is working with providers across Kansas, which include both rural and urban facilities. In a former life, before I came to KFMC, I was the risk and quality manager and compliance officer for Critical Access Hospital in Western Kansas. And so I've worked my entire career in Kansas healthcare delivery and have a deep passion for rural health. In my current role, I also sit on the board of the American College of Healthcare Executives chapter in Kansas, really advocating and working with leadership from hospitals across the state, as well as serving on the board of Civitas Networks for Health, which is a national organization that kind of brings together rural health improvement collaboratives and health information exchange. And so I think my perspective as it relates to this committee is really at that intersection of leadership, performance improvement, quality improvement, risk management, and then health information technology, data, artificial intelligence, and how those kind of intersect and play with each other. So happy to be here.
Thank you so much, Sarah. Thanks for joining us. Well, I think that concludes all of the members and member organizations introductions. And so now, if I missed anyone, please let me know. But I'll transition over to Secretary Stanek, who's joining us from KDHE.
Oh, good morning, everybody. I know many of you, and so glad to see this mix of people on our committee. Obviously, with our partners at the CARE Collaborative, we've got the grant and Rural Health Transformation Program in full launch mode, and things are going well. And so I really hope in this aspect of the grant proposal that we can come out with solutions that meet the desired state that we had put in our application to help support rural providers in general. And I hope from this initial launch of this committee that we get something that we can then have a proof of concept on and then expand it out and then get more support and interest in launching more technology solutions that provide, first of all, access to care, and then all the rest comes with it. So very excited. Thanks for being here.
Thanks so much, Secretary. And Matt, Laura, are you on the call? Transition
I
over to you.
am. Good morning, everyone. I'm Matt Lara, the Chief of Staff at KDHE, but also the RHTP Program Director. And so I'm just here to listen and learn from all the experts, and I'm excited to get this project started. Thank you.
Thanks so much. And I will turn it over now to Marty Ross with CCA. Oh, you're on mute.
I'm unprepared. Sorry about that. I'm Marty Ross with the University of Kansas Healthcare Collaborative. We worked with KDHE, supported them in development of the application for the RHTP funding. And it's very clear from the Notice of Funding Opportunity that CMS is putting a heavy emphasis on the effective use of technology to transform rural health. And very excited that so many folks answered the call to be part of this committee, help us think through those challenges. As Secretary Stanek said, find that proof of concept where we really can change the world with this team.
Thank you so much, Marty. And I will turn it over to Kristen with BioSTL, and you'll get to hear a little bit more from her later as well.
Good morning. I am honored to be here with all of you today. As Sheena said, Kristen Neighbor with BioSTL. And I will go a little bit more into my background and who BioSTL is in a moment, but I am really excited to be on a call with all of you and to be supporting you all as you rethink what healthcare can look like in rural communities. I have spent the last decade designing healthcare to be able to meet those who need care where they are and to support the teams in delivering that care. So I'm looking forward to getting to know you all much more and supporting you in that endeavor.
Thanks so much. All right. I'll let you get a chance to get to know our team here in a minute. But I think for now, we'll close out introductions unless I missed anyone. And then we will keep it moving. Thanks so much, everyone. We really appreciate all of you, your time and your attendance and your participation in the committee. It's really great to get to know all of you that I've been corresponding with for the past couple of weeks. All right. So who are we? I'm Sheena. Again, I said I'm leading this effort for KHI and facilitating this, but a little bit more about me is that I lead the access to care work at KHI. That includes Medicaid policy, and within that strategy area of work, it also includes behavioral health, rural health, workforce issues. We do research and convene conversations, facilitate work groups. I have about 15 years of experience. My background is in public policy, and I've worked in state and local government throughout my career as well. So very honored to be able to lead us through this effort with my very capable and excited team members. So I'll turn it over to them to introduce themselves. I'll turn it over to Shelby Rowell, who is on our team.
Hello, everyone. My name is Shelby Rowell, and I'm an analyst here at KHI. I've been here for about 2.5 years now. I started my career at KDHE as a legislative liaison, so worked pretty closely with Matt and Secretary Stanek while I was there. At KHI, I get the opportunity to work on a lot of different topics, but some of the few that I think are relevant for this group today is I'm part of the team that works deeply in artificial intelligence work, specifically looking at artificial intelligence policy and integration of artificial intelligence with the public health sector. And then I also am the hub director for our public health infrastructure grant Region 7 Technical Assistance Hub. So I'll go ahead and turn it over to Wyatt. Thank you, guys.
Thanks, Shelby.
Good morning, everyone. Excited to be with you all. My name is Wyatt Beckman. I'm another team member that's really excited to help facilitate this committee. I've been with the Kansas Health Institute for 7 years, and I help lead our rural communities portfolio along with a great set of team members. I too am from rural Kansas. I'm from Ness County and grew up around healthcare, and my family is still in healthcare and still calls Western Kansas home. So this work is very meaningful to me, and just excited and honored to play my part in helping you all do the important work that you're going to do.
Thanks, Wyatt. And we have another member of our team who we rely on as subject matter expert in this area, both in health and artificial intelligence. She's traveling to Hutchinson today to deliver a workshop, and so always on the go, but I will let her introduce herself. Tatiana Lin is our colleague who will also be assisting us in this effort.
Thank you so much, Sheena. I want to make sure you can hear me okay?
Yes, we can hear you.
Thank you. Well, it's a pleasure to be here today. I'm very excited about this effort and being a part of it. My name is Tatiana Lin. I'm a Director of Business Strategy Innovation at the Kansas Health Institute. I've been with KHI about 19 years in different roles and previously led our population health team. I'm also a subject matter expert for public health infrastructure grants, specifically to artificial intelligence. I have led the development of a framework for AI governance and AI policy development for agencies. In this framework, we were very delighted to see has been added to the Centers for Disease Control and Prevention resources. We also have been doing capacity building workshops around Kansas, as well as state and territories, to help develop their AI governance structure and AI policy development. And specifically in the rural space, we have done some work to look into the issue of rural invisibility in AI systems and how to make sure that when AI systems and the whole AI lifecycle gets adopted, that it has rural context and being able to be adopted for rural context successfully. So we are exploring with our partners at Fort Hays University, as well as got some attention from national partners in the concept of rural proofing. So making sure that AI systems are rural proofed before they get implemented. So I'm excited to provide what we have learned and learn from this great group of experts. Thank you for the opportunity to be here today.
Thanks so much, Tatiana. Thanks for joining from the road. All right. I wanted to talk a little bit about how KHI and how we intend to approach facilitation. So our model is maybe similar to other folks, but maybe a little bit different because we do bring subject matter expertise and research experience. We do support our work groups and you all, and we intend to also support you all in your work in many different ways. So our job is to listen, to gather perspectives from members and stakeholders, to inform, so to provide relevant research examples, environmental scan, information gathering for you all to make evidence-based and data-informed decisions. Also to facilitate, obviously, to guide our discussions, to build consensus and to help you develop priorities based on the information that you have in your perspectives and expertise. Connect, so coordinate any collaboration among providers, experts, state partners, and BioSTL to make sure that everything is aligning and we're rowing in the same direction to meet our goals. Also to document, so we'll capture key decisions, recommendations, and next steps. We take all of your feedback that we receive in the meetings and we turn it into something actionable, either a written document or otherwise. And then we advance the work. So support development of actionable deliverables, which we'll go through here in a little bit, aligned with the RHTP goals. And I'll pause to see if there are any questions about the approach or okay. All right. I wanted to take a moment to go through the timeline. So we do have we front-loaded the meetings in order to meet some of the deliverables that are outlined for the committee's work. So we launched a project in May, did the recruitment. Our first meeting starting today, June 4th, you can see. By July, we have to have our charter completed. So we're going to spend the next half of the meeting today going through that. And so in order to get a jump start, we've drafted some ideas for you to weigh in on. In July and August, those meetings are going to be focused on providing guidance to BioSTL to support the deliverables that they're working on, including developing an ambient AI RFP and emerging technology use cases, which Kristen will talk about here in a minute. And by September 30th, we'll have to have our final committee work plan and budget completed. And that's why we have that 4-hour kind of working meeting scheduled in person in July so that we can do the bulk of that work together then. In August, by August 15th, we'll have the draft of that plan completed. Then that brings us into October, where you'll hear about a global innovation summit that's being hosted by BioSTL. So they'll be looking to the work group for recommendations to attend and also for you all to attend and to inform the topics for that summit. And then finally, the end of the grant, year one is October 30th. So we'll have to have everything submitted by then from the work group. So that'll take us through year one. It's May to October. Just given how the federal cycle went in the funding, that's year one. And then we'll work on in year two, implementing the activities according to the work plan you developed, and we will keep it moving.
So Sheena, this is Aaron. Just a couple points that, I may just have some gaps in terms of how this process is rolling out. I understand there's some money set aside within what's been delivered to Kansas for emerging technology funds. And based on what you just spoke to, we've decided to pursue an ambient technology related to some of those funds. I don't know where that decision was made, where this group provides input, and then where the RFP decision is made. That would be helpful just for me to understand the charter of this group versus some other activities that are going on, because all of this is moving very fast, and I think there's just some gaps.
Definitely. So I think given according to my understanding, and others can weigh in, Marty specifically, if you'd like to comment, the timeline, the part of the grant funding is that the state needs to make progress very quickly on the items that were outlined in the application. So for year one, I believe that in addition to this, there are some things that are kind of baked into the proposal and other things where we'll continue to be able to provide input on. So some RFPs are under development and will be released soon. And then the other pieces is what the group is going to be working on, and we'll help identify the areas where we can provide input in. And that's part of the priority setting and work plan that we'll work on after or during the time that we're providing input on these specific initiatives that are underway with the state, and others can weigh in if I didn't explain that correctly.
Sheena, just to get down to the dollars and cents, the state's plan includes about $6 million in year one to support rural facilities acquisition of ambient AI listening technology, specifically those facilities that utilize Oracle, in that the Oracle system has one option that can be utilized for ambient listening within their system. So it's an add-on to their existing technology. And initially, we're working with GPHA to roll that out, given their facilities utilize Oracle. We'll continue to identify the other non-GPHA facilities with Oracle and support them. Then there's deferred funding to year 2 to support other facilities operating on different systems to acquire ambient AI listening technologies. Separate and apart from those funds, there is a emerging technology grant program. I'd leave that to Secretary Stanek or Matt to provide additional information, but that is similar to the 2 grants funds from earlier this year, the Regional Partnership Grant Program and the Transformative Capital Grant Program. Those are going to be dollars available for third parties to apply and be awarded funding based on criteria identified that will be identified once a request for applications is released by KDHE.
Sheena, if I can real quick, Marty just alluded or mentioned our grant opportunity. We are in the process of getting that finalized, and either late this week or early next week, the request for applications for those emerging technology grants will come out. It's about $10 to $11 million for year 1, and so we'll get more information sent out later this week or beginning of next week to everyone.
This is Janet. I just want to add one thing just to Andrew's comment and just to remind everybody, because it's easy to get caught up in this first year. This is a 5-year opportunity. And so when we speedily wrote the application, it was great, all well intended, but we also know this is very iterative. So things that we put down a year ago, November, for the final application, most likely, and we're seeing that in some cases, is bound to change a little bit. So the purpose of this committee is to weigh in on things as we go forward. But this year 1, we're so front loaded and have to execute on this. Right now, what Marty described is very accurate, and there'll be time down the road to have this committee's input on ongoing initiatives and what we might tweak. We also have to get that all approved by CMS when we make budget and application changes. But this first year, I think you're right. It's really rolling down the tracks fast, but it'll be okay. So, and I'm very excited to see what we do get on the grant that Matt and others just described, because that will be going out very soon. So I hope that helps a little bit. Thank you.
Yeah, thank you, Janet and others. That is helpful. I understand we're kind of joining the plane as it's taken off and is already in flight, and just understanding from the context you gave where we're at and where we're going. That was helpful.
Thank you so much. Any other questions about the process or this immediate timeline? That was very helpful. Okay. We can go back to sharing slides, if you will, Wyatt. All right, I'm going to turn it over to Kristen, who is going to introduce us to BioSTL and their role in the committee's work. Thank you.
Sure. Thank you. BioSTL is a globally recognized digital health incubator and convener. 15 years track record of developing, sourcing, and deploying digital health and AI innovation across healthcare, life science, and agriculture organizations. In 2021, Bio launched the Center for Rural Health Innovation with a focus on access, healthcare affordability, capacity, digitally connected rural economies, and focusing on that economic and social drivers of health. And that was really what brought us to this work today. I personally have spent the last 30 years driving growth and engagement through human-centered design, process reengineering, and lean facilitation, and ultimately translating complex business or operational requirements, including clinical, into scalable technical solutions and building frameworks that allow us to repeat and measure that impact. So Secretary Stanek mentioned that earlier. Our role is going to be taking all of your information, your needs, translating those into requirements, very specifically for the non-Oracle ambient listening tool, And then also aligning on what are those key use cases that are problems you need solved that enable you to really keep care close to home and creating RFPs and finding the solutions. This work will be done in partnership. I'm excited to get to meet all of the folks from Digital KC and identifying what are those solutions that can bring to bear for you. So in year one, it's really how do we translate your needs into requirements from an ambient listening and then aligning on the next two prioritized use cases for going into year two. I look forward to getting to meet you all. Sheena also mentioned that BioSTL hosts a global summit. This year it will be in October, and all of you are invited to attend. It will have 2 days with a focus on rural health transformation. We are hoping to be able to use a lot of the information that is coming out of the ETC meetings to really be able to drive those topics that are most relevant to you and bring in a lot of those partners that will be critical in helping us to be able to solve for those problems, as well as webinars that will address some of those key issues or concerns that you have and how do we redefine what rural healthcare can look like in the future. So I know I started off by saying I think this is incredibly exciting. I envy the role that all of you have to really change what healthcare looks like in your communities, and excited to be able to support you. And behind me with BioSTL, there are multiple other advisors with 30 plus years in the industry and serving from different aspects that we'll be pulling in as needed along the way. So looking forward to getting this work started.
There, I did it too. Any questions that come to mind for Kristen initially? Okay, all right, we'll move us along. I did want to remind everyone, I believe you have this in your communications for the committee, but here's our meeting schedule. As mentioned, we are front-loading our meetings, so we'll have 2 in June and 2 in July in order to meet the deliverables we just went over, and then it moves from monthly thereafter, after our big meeting in person on July 29th, which will be held at our offices at the Kansas Health Institute in Topeka, right across the street from the Capitol. We will move to monthly virtual meetings in August, September, and October. All right, before we kind of get into it, I thought it would be helpful just to kind of get our brains in the right space to get thinking about this topic. And so we are going to do a compass points exercise together. And so we have a few questions there for you, and I just invite you to either come off mute or share in the chat. First question is, what excites you about the idea of leveraging technology to transform rural health in Kansas?
I think it's just
go ahead, Scott.
Sorry. I think it's just the opportunity to allow the population of rural Kansas to stay where they are. And, I posted something a while back about how important it is for rural Kansas as far as our supply chain when it comes to energy and food and everything else. And in order to support them, we need to make sure that we have healthcare available for them, as well as other opportunities for the rural areas, and healthcare being one of the major parts of that. So I think the technology, the applying technology for distance medicine and other technologies that make it available for them to have access to specialty care in the region is extremely important. And like I said, I've always been driven by finding ways to provide higher quality care in rural Kansas and create that efficiencies around that. So that's what I'm excited about, to find the new technologies, including AI, including the teletechnologies and everything else that's available Hayes Med actually started one of the first telemedicine or distance care things back in the late 80s, early 90s in almost across the entire country. And Dr. Cox did a great job of using that technology and showing and proving that it could work. And it's taken a long time, but I think it's finally being readily accepted by the rest of the industry. So it's important that we continue to find ways to provide that those solutions that will help these people be able to live in rural Kansas and still get access to high quality care that's available in the urban areas.
Thanks so much, Scott. I'll move to Terry, then Sarah.
All right, let me lower my hand really quick. So a lot of what Scott said was part of what I was going to say. We have a lot of our members are in rural areas. In fact, over half are in rural areas or have sites in rural areas. Part of the problem in some of the, especially western northern Kansas, when you have a really small population and you know the geography is wide, there's just a lot of driving, and keeping people where they are is really, really important to me. We have a couple people at our organization who are remote. One of them lives in Scott City, and she has to drive to Hayes to get medical care. And in some instances, sometimes she has to drive to Wichita. So to be able to keep people, in their home and not make them take a day off work to go to the doctor is great. But the other thing is the services that folks who live in rural areas that don't get that people in urban areas get is all those kind of accessory services that are from their non-medical drivers of health that, is there something that's kind of what I'm interested in. Is there something that we can do with all of this that can not only help with the medical, but the non-medical needs like transportation and all of that stuff. So I'm excited to find a solution that keeps people from having to drive all over the place or just be able to get the services that they need, because some won't drive to get the services that they need. Thank you.
Thanks so much, Terry. Sarah.
So mine is from a little different perspective. I've hosted 2 learning sessions in the last year where we've heard from healthcare organizations about their needs around AI, and have heard pretty routinely that most facilities, even if they can't afford to access, or even if they can't afford to access but haven't done anything with ambient listening, they recognize that that is probably the single solution that can help address some of their current workforce concerns, burnout concerns in rural facilities, recognizing that just that one tool can help them with what is probably their most in the face and pressing issue with burnout, thinking about reducing time and documentation, et cetera. But most of them have articulated, even if they have the resources, they have no idea where to start in selecting a solution. And so I am always excited when what we're planning kind of globally or at the state level directly meets an articulated need of the providers that are in the field doing the work. So I think what we're talking about today directly relates to what I've heard very recently providers need, and that excites me.
Thanks so much, Sarah. It's always good to hear, and I think a good example of like we're all doing this work, and so we're bringing all of our perspectives into the conversation. So I appreciate that. Chris.
Yeah, I'll just double click on everything that was mentioned, but one specific thing that I would mention is, work for an institution that also train our clinical workforce is that, AAMC research study recently shows that we're going to be short of care providers in the next 9 to 10 years by 86,000 physicians. And with that shortage, I think that's going to impact rural community even more. And so, I think about this as how do we, leverage this recent, capability to be able to really not just bring care to our rural health population closer, but bringing those expertise and specialties to their doorstep so that they don't have to leave their home or community to be able to be wrapped around with additional specialty. And so, as we know, as the population for care provider continues to shrink, we want to make sure that we have the necessary care that can be provided. And I think this could be a transformational thing to not only remove administrative burden, but also to really bring the clinical intelligence that's necessary.
Thanks so much, Chris. And I'm going to move to comment on some things that all of you put in the chat. So Cindy says patients from all areas to get equal access to healthcare. Secretary Stanek said solutions that address the workforce challenge we all face. Dr. Gauze, closing care gaps and disparities through innovation. Double click that one. I think this is going to be a term for our committee now. The pace of change and acceleration in digital health right now with the proliferation of AI is opening up many opportunities for communities and healthcare sites, potential to overcome prior challenges from Liz at Digital Health KC. Thank you so much. All right, well, I'll move us to Wes. So we want to start with the positive, but are there any concerns, and what concerns will you watch for in leveraging technology to transform rural health in Kansas?
I'll chime in here on, and having worked in this field for a long time and worked with large and small institutions around the country and around the world. I think there's often a lot of focus on finding a technology and implementing a technology, and that's wonderful. But what we hear all the time from institutions is, I have to support this technology. I have a very small staff. I have limited bandwidth to both implement and ongoing support. And so I'm super excited about the technologies. I think we're on the right path. I think Ambient is a great first choice, so easy to line up behind that. But I want to make sure, and we've got enough people on this call that are living the rural health and rural IT experience. I want to make sure we leave behind support, funding to both make sure these solutions are supported ongoing. We had a call, Liz and I had a call with the CEO of one of the hospitals in Western Kansas, and we were talking about telemedicine. She goes, "Sure, man, we love telemedicine. In fact, I have a closet full of telemedicine solutions that we've implemented over the last 10 years. And the vendor goes out of business. We've lost support. The partner we had with it dropped out. And what we need is sustainable solutions that are affordable, supportable, implementable, and usable." And I think I just want to make sure that this is not technology chasing a problem, but that we think the 360 problem set and the life cycle of support, both operationally and financially.
Thanks so much. Chris?
Yeah, I was just going to support Dick's comment about sustainability and supportability. Healthcare, the workforce labor has increased about just over 5% in the last 3 years, year over year. Facility costs have risen by 6%. The technology and computation has risen by 16%. And so it's doubling anything that's really from a sustainability and cost perspective that we're going to face. And so I just want to make sure we're very thoughtful about not just making sure we select the technology that's supportable, but also it can live beyond the 5 years that are going to be funded, so that we can make sure that we're not overburdening our rural community healthcare providers with additional costs.
Thanks so much. I see Scott's hand raised.
Yeah, just I think to build on what Dick said as well, that Ambient's a great first choice. I think the beauty of the Ambient is it's pretty easy to implement, and there isn't a lot that's necessary from the providers that we've engaged with to this point. But the other piece is, I think, just finding the technology that is not intrusive to the provider giving care. I think the first thing that I always dealt with previously was, you added X number of clicks, you made me go look in a different system to use this technology. You like created an alert that was intrusive to my care and what I was thinking at the time. So I think just finding the technology solutions that fit within their workflow is going to be important to make sure it doesn't distract from the patient care that they need to be giving and make it just truly seamless within their workflow.
Thank you so much. I'll move us to the chat again. Doug, Stacy says, excited about technologies that use AI, telehealth, and other technology platforms to keep care close. Agentic AI has some exciting opportunities, and that was from the previous question. And Doug, I'm not sure if we had a chance to meet you, so if you want to come up and introduce yourself. Sorry if I missed you initially.
Actually, I think my first meeting went to my spam, so I apologize.
Sorry
yes,
about
I'm
that.
Doug Stacy. I'm the CIO here at Labatt Health. So thank you all for having me.
Thanks for joining. I'm glad we got it worked out. Okay, and then there's some concerns just checking assumptions about the community and their ability to leverage the tools that are offered. So yeah, really like tailoring it to the community's needs, ensuring needs are identified before identifying solutions. So yes, like ambient AI, but this committee's work will go beyond that. And so thinking about concerns related to the overall purpose of the committee. Cindy says wanting to watch that we're focused on solutions that help those working directly with patients to transform rural care. And that is something that we're going to talk about here in a little bit too, to make sure we can incorporate those perspectives and not support technology that does not deliver, does not directly support rural health in all areas equally. Making sure technology is supporting what you want, ensuring solutions are reducing the burden for both care team and patients, and making sure that solutions do not erode trust between providers and patients. Thanks, Tatiana. All right, so looking north, I'm wondering if anyone has gotten the gist of this exercise. It's really about geography as well. But looking north, what else do you need thinking to know or find out about? What are you curious about in helping leverage technology for transforming rural health in Kansas? This is really intended to help us kind of gather some information for the committee, whether it's resources, data, studies, information to help you in your work. So what do you need to know? What are you curious about?
Yeah, I think this is somewhat of a concern, but also what we need to know and what we need to understand about rural health throughout Kansas. As you try to implement technology, differences in terms of clinical resources and how an organization operates is one of the key things that prevents being able to use technology across a large group. As I've started to get familiar with a number of different rural organizations within Kansas, each of them approaches how to deliver care a little bit differently, which makes our task in terms of figuring out how to apply technology to those solutions or to those problems and generate meaningful change very challenging, because we've got to find some pieces of technology that have an impact irregardless of how each one of those organizations operate. So as much as we can understand the common denominator across the organizations that we're looking to support, I think that will be one, a challenge, but also two, something that we'll need to spend some time on to make sure that we're not making assumptions based on our limited knowledge of various areas throughout the state.
Thanks, Erin, so much for that perspective. Secretary Stanek?
I just, and it might go to north and south, but I think one thing we need to think about is where the role of the provider comes in before we launch into moving on any of the technology. And in our respective organizations, say a number of rural facilities, for example, what are they going to need in the way of support or to demonstrate that this is a good thing? And where does the providers come into play? And I think research on that, because a provider is going to want to look for, in my experience, ease of doing business and how this is going to help them as well. And so what is our role in trying to figure that out before we launch into too much technology or too many initiatives? Thanks.
Thanks so much. All right, and looking to chat. Need to better understand what patients and providers need, a common theme there, and understanding the issues with technology or technology use for rural providers. Clearly understand the problems that we're trying to address and need to hear the community's voice to guide the approach. So really thinking about how do we get those rural communities feedback or perspectives into the conversation. How we can sustain what is implemented past the 5 years. That got a lot of likes. Yes, definitely sustainability and understanding data privacy, consent, accuracy, human oversight, quality, reliability, and potential biases of ambient AI generated documentation. Yes. All right, and to wrap up this exercise, I want to ask if there are any suggestions you have for leveraging technology to transform rural health in Kansas. This is just to get us thinking, but we know we have a first choice of ambient AI, but are there any other suggestions you have for what might work, or in your experience, what you've seen as a proof of concept that might be helpful?
Something that we're working on that I would ask, because we've got some folks living the trenches every day, both on the IT and the operations side. I think what would really be helpful for people that want to help in rural communities for health IT and offerings, and I'm going to use a term and it probably isn't perfect, but what's the affordability threshold here? Because one of the things that we find is we get calls from people that say, oh gosh, I'd love to help in rural. And we say, great, the opportunity, the need is great. And then they're like, well, what do you think they're willing to pay? And we say, well, they don't have a lot of money. You're not going to save FTEs because people do multiple roles. And they're like, wow, well, I don't know that we can do it for that. And I think we need to set expectations as we invite people in as problem solvers to say, this is the threshold that you have to meet, which is doable, by the way. Okay. But I think we could save us a lot of time as people come into this process and think they're going to solve problems through technology. If we give them an affordability, like to be competitive, to be impactful in this community, this is a $20,000 threshold, not a $100,000 threshold. Can you help? And I don't know if others feel that way, but we've already been trying to shift some of the thinking and keep some people at bay that have champagne, tastes and don't understand there's a beer budget here.
Thank you so much, Dick. Very helpful. Kyle, and I see you left a comment in the chat too.
Well, and I would say I think Dick said what I was going to try and say just a lot better. Because this is something that we started seeing a few years ago in behavioral health, and frankly, behavioral health had stagnated from a technology side for decades, and not being involved in the HITECH Act and things like that. But with the CCBHC and now with RHTP, the tech vendors come around and they can tell you, here's what you need, and here's how your life can get better, and then just go get this free money from the federal government, or go get this free money from the state government. There's no free money. It all should have accountability attached to it if we want to prove successes. So I think that funding side is a real thing, and that goes to my comment in the chat about vetting processes. And we've actually started doing that kind of thing with our association to tell our members, hey, come to us and we'll vet these things and see who's used what and if it's been successful and if it's the real thing.
Thanks, Kyle. Sarah, I'll move to you.
I think kind of to the flip side of Dick's point is some of this is in presenting the business case to facilities and how optimization helps them offset costs. So it's not just about what their price point is, but we know that ambient listening better captures the engagement or the encounter with the provider, which can enhance coding, which can enhance revenue cycle. So there are definite financial benefits in addition to saving, burnout, adding potentially more time to see patients, et cetera. So there's the price point, but then there's also the value add. And a lot of that is financial, whether you're talking about ambient listening or coding AI, technologies to facilities that are directly impactful to their, financial positioning.
Thanks, Sarah. Marty.
Just as a follow-up, as we were discussing in the application development phase, the idea behind the ETC, Jody Schmidt always referred to it as a group that would provide the good housekeeping seal of approval for technologies for rural providers. So that, as you were discussing, Sarah, the financial impact of implementing technologies, they don't have the capacity to do that analysis. This committee and the resources it can bring to bear can fill that gap for our rural providers.
Thanks so much. Kristen.
Sure. I also just commented in the chat, Dick, I agree with everything you said. And I think as we talk about defining what those requirements are, whether it's for the ambient listening or what the future use cases are, it is not just what are those technical requirements, but it is really setting what is that rubric or what is that key criteria that we want to be able to measure any potential solutions against that they have to meet to make sure that it's not only implemented, but it's operationalized and it's something that's sustainable. And I think we've said several times that benchmark of saying, what does sustainability look like at the end of these 5 years when this funding has ended? How do we become a self-funding mechanism or be able to continue everything that is built is a fantastic place to work backwards from as we define what those requirements look like.
Thanks so much. I'll go back to the chat, and I think similar sentiments across the board. And Tatiana had a comment on identifying a right-sized AI governance, what that should look like for technologies, and how to accelerate its development and implementation as AI becomes increasingly integrated into organizational workflows.
Hey, Sheena.
Mm-hmm. Yeah.
Yeah, I said a couple of comments as I'm hearing kind of what everybody's saying. I think some interesting things I've seen from my perspective. One of the things when it comes to vendors and funding, I mean, I get a lot of contact from people now that are saying, oh, we're doing phone systems, we're doing all these kinds of services. And they're like, just use RHTP money. And so we're getting everybody coming out of the woodwork saying, we know you have money and try to repurpose it to spend it on this system or that system. And so I'm seeing that from all kinds of vendors that have kind of been reaching out. And so I think, like you said, a vetting process, I think is important with that, because there are people that are going to come in and pricing is going to be more expensive because they know that there's, grant funding. And so when you get to the end of that, it's really, is that still sustainable? Which, I mean, for us and our organization is something that we're looking at is like, what's this going to cost me in 5 years? That, after that initial period of where that money was being, coming in externally. So I just think the other thing too that the biggest concern I think that I see is you have this gold rush of AI and innovation and all these companies that are moving extremely fast because they're being founded and doing all this development work in a span of the last couple of years. And then you have, I mean, let's say 4 major EHR companies, especially in rural health, so what I've seen is you have all these companies that are saying, hey, we can do all these great things. We can do all your chart prep with AI. We can do the ambient AI. We can do rev cycle. We can do all your coding and all these great things. But then you kind of circle back to Cerner and Oracle and Meditech and Epic. And that's where you run into the roadblocks because these people are developing this stuff with current technology. And some of those EHRs, obviously, as you guys know, are not built on the most current of technology. So that's historically what I've been seeing over the last 6 months is these great products are available, but on the EHR side, you don't have that same support. And these people are waterfall, hurricane type things, and EHRs are glaciers of just moving so very slow. With good reason, I guess, because these companies have been around for 20, 30 years, even longer. And so that product is not going to change as fast as somebody who started a company 6 months ago that's doing, ambient AI or those kinds of things. So that is a concern of, hey, we find a really great product, we want to recommend this, but getting it implemented into these EHRs becomes an issue. And then making sure that that's also affordable, because we see that on the EHR side as well. They know that, you know, there's, oh, that interface is going to cost you $20,000-$30,000 to be able to integrate with that. And then just the ongoing maintenance of those things. So I think just that's historically what I've seen, especially most recently with some of these things. And those are things I think we can overcome that are just challenges, but just things that I'll be thinking about as we go through this process.
Yeah, Robert, I think that's a great point. And just to expand on what you're saying too, you know, when you get out into some of these niche vendors that are moving very quickly, you don't know how sustainable their business model is and what's going to happen to them in the future, who's going to purchase them in the future, what the product's going to look like in the future. So from creating a sustainable platform for rural providers and rural health, that's another challenge. And I think that's some of what you're getting at.
Yeah, because they may come and go in a year or two, and we'll still be here, right? And it's like we have to be able to keep going with whatever we decide to use, and hopefully it's not something where we have a great product and it's not sustainable. That is definitely a fear, but I will say kind of one of the maybe the brighter lights that I've seen with some of this is because there are so many companies, we have seen a lot of competition. So we've had vendors that have kept coming back to us and saying, okay, well, now this product can do this. And they see that, you know, another company has now added a feature. So there is, I think, a really good competition that's driving some of that innovation, which is also translating into the price, because people are finding where that price needs to be, where they can make money, but it's also affordable to organizations like us. So I think we're headed in the right direction, but it's definitely something we look at cautiously. And from that perspective, like you said, of is this company going to be around? Are they going to be able to sustain their business model? So we have a solution long term.
Thank you so much for the great discussion. I know if you have any other thoughts that you want to share, please put them in the chat. Any final thoughts about the as we move along? Okay. Thanks so much for being so engaged and willing to share and participate. This is what I know we're going to do a lot of productive things together, and just excited to continue the process. All right. Okay, and now I'm going to turn it over to my colleague Shelby Rowell, who will just kind of orient us to where the ETC fits in the overall plan before we start to dive into the charter with Wyatt. Shelby?
Thank you, Sheena. So I don't know what happened there. I was unmuted and then I became muted. So we'll go ahead and keep this section pretty brief and high level so that we can really dive deeper into the charter and start to have conversations about the charter. So next slide, please, Wyatt. So this first slide really just provides an overview of what the rural health transformation funding structure looks like. So this information may be familiar to some of you, but also maybe newer to others. So just to provide that general overview, again, this funding is $50 billion across 5 years, going from fiscal year 2026 to fiscal year 2020 or fiscal year 2030. So the way that the funding is structured, we have two different funding pots. So we have that baseline funding where all of the states would receive that $100 million for the first year and in subsequent years. And then that workload funding is the other 50%. And this is driven by the quality of the application, the state's data, which was included within that application process, as well as the policy details. So that workload funding, again, is where states are able to increase their funding amount. Within Kansas, Kansas was awarded $221.9 million in fiscal year 2026, which was the 6th highest across the states, really indicating the strength of the Kansas application. Next slide, please. So this provides an overview of what that Kansas-specific plan looked like. Within this application process, states were really able to design their own customized rural health transformation plan, which could focus on the unique needs of those communities and of their states. As discussed earlier within our conversation at the top of this meeting, there were a few priority areas that were identified within that notice of funding opportunity. So you'll see some consistency across states. Within the Kansas application, the 5 core initiatives that we see in that plan are prevention, accessibility, sustainability, value-based care or enabling value-based care, as well as technology. So this technology aspect is what we're really going to focus on today within the presentation. So we know that even though the technical aspect is its own core initiative, that initiative is also kind of taken out across those other initiatives as well. So it's one where it's cross-cutting. It shows up in a lot of different areas. So looking at Initiative 5 in a little bit deeper context, by 2031, the Rural Health Transformation Plan or program aims to ensure that remote patient monitoring is available as needed for acute, post-acute, and chronic disease management. Access to specialist services via telehealth is available as needed for rural Kansans. Third, all rural providers should be aligned with TEFCA, which is the National Framework for Health Data Exchange, with barriers to data access eliminated. And then finally, rural providers should have successfully adopted secure, well-vetted AI tools to improve both clinical care as well as operational efficiency. So, looking at Initiative 5, what are some of the programs that are under this initiative? The 4 that are included are Remote Patient Monitoring Program, the Telehealth Navigator Program, the Data Infrastructure Program, and then finally the Emerging Technology Program. And the Emerging Technology Program is where the ETC is located within that plan. So finally, diving a little bit deeper into the role of the ETC, before we get into our charter conversation, the Emerging Technology Program was established to address a real gap that rural communities are facing. Rural providers simply lack the resources to identify, vet, and implement new technology on their own. So the ETC kind of serves across 2 different lanes. We have consumer-facing technologies and artificial intelligence. On the consumer-facing side, the ETC will evaluate and recommend solutions for specific rural patient populations, develop implementation guidance, provide technical assistance, and also administer funding to offset provider costs. And on the AI side, the ETC will assess and recommend solutions in 3 priority areas. These include clinical documentation, predictive analytics, and operational automation. So for AI adoption, the ETC will also promote guidance, provide technical assistance, and fund implementation support for rural providers. So in short, the ETC is really acting as that expert intermediary. So doing some of that heavy lifting so that rural providers don't have to navigate this alone and by themselves. So the last thing I'll note, we know that these are kind of identified separately within the plan, but there are opportunities for that consumer-facing technology side and AI to also have some overlap as well. So again, this is a nuanced and really dynamic group that I think is very well suited to help rural communities face some of the barriers and challenges that they're experiencing right now. So with that, I'll go ahead and pause for any questions. And if there aren't any, then we can go ahead and move into our charter conversation with Wyatt.
Any questions before we move forward? Don't want to cut anyone off. Okay. Well, if something comes to you, please use the chat Otherwise, we're gonna move forward into charter development and feedback. So we've got a lot of great discussion already. So thank you all for being here, for being so willing to participate. Talked a lot about what you all are interested in seeing out of this work. The charter is really going to help us collectively think about how we work as a group, work as a committee. And so we've developed some draft ideas for you all to respond to for the charter. And as you're thinking through some of these pieces that we'll talk through, here's some questions to consider. What needs to be changed? What's not working for you? What's not resonating? What needs to be added? Is there anything missing that you say, I didn't hear that key piece of how I want us to operate, how I want us to reach consensus? And what can be removed? Is there anything that doesn't belong? So keep those questions front and center as we move forward. We're going to collect feedback in a couple different ways. And as we talked about, our role is to be your facilitator, your support, and gather all this feedback, process it, and bring it back to you. So one of the ways we're going to do that is through a tool called Padlet. So one of my colleagues is going to drop a link in chat for you. Thank you. So if you're at your computer, I recommend pulling that up on your computer. Will be easier to see rather than your phone, but you can do it on your phone as well for those that are out and about. When you click on that link, what you're going to see is a big board with lots of different topic areas and some questions for you to respond to. Before we jump in, it will help us, it will help you all interact with each other. Please rename yourself. So you can go to the top right and you can change yourself from courageous cougar or fearless puma or whatever name they gave you, and change it to something that is easier for everyone to know who's contributing that comment. So your first name and organization, first and last, would be great. So please do that before you dive in. And if you have questions on that, drop a comment in chat, and my colleagues will help work through that. Once you've renamed yourself, this Padlet is your tool to add feedback as we work through and talk through components of the charter. So please feel free to add comment. You can add your own comments by clicking on that plus button right underneath each topic, or you can add for each question, if it fits within what needs to be changed or what's missing, you can click that add comment button and it will stay right there with that card. So if you have any questions, let us know. If for some reason you're not in a position where you can use the Padlet, please continue to provide feedback in chat or jump in if you want to contribute. But Padlet will make it easier for us to gather all this feedback. Yes, and as Sheena reminded us, just come off mute, raise your hands, or add things in chat. We'll take feedback from anywhere and everywhere, but Padlet is one tool we want to use. Okay, with that tech and how, let's dive into some of the charter. So we talked about the purpose of your work. So part of the charter will discuss the purpose of the committee and include these components that the Emerging Technology Committee will establish a transparent and collaborative process that supports this long-term capacity of Kansas rural health stakeholders to evaluate and adopt those emerging technologies. One of the other purposes is evaluate the use of AI and those other emerging technologies, to review recommendations from subject matter experts, to make evidence-informed recommendations. So that recommendation piece is a key purpose of the committee, to identify high-value AI and emerging technology use cases that will be relevant to Kansas rural providers. And that final key purpose, to provide stakeholder feedback and guidance on vendor selection, RFP development, and budget priorities. So as you review those key elements of the purpose of the committee, add to Padlet or add to chat or come off mute. Given our time, and I see a thumbs up, so thanks, Aaron. I'm gonna kind of keep moving us forward. We want some time for open discussion, but that's why we have the Padlet. So please sort of waterfall your comments and feedback as we go forward. So the next section in our charter is nomination and selection process. So the ETC was initially formed through a collaborative process involving the CARE Collaborative, our facilitation team, and other Rural Health Transformation Program stakeholders. I think you all have already demonstrated a lot of knowledge and expertise on this topic that you've brought to this discussion. And the team that collectively put our heads together to identify you all and invite you to participate. We wanted membership to be designed to ensure representation from a broad sectors and a broad range of perspectives. Moving forward, their part of the charter needs to identify how new members can be added to your committee. This is some proposed pieces of how that process can happen. So the ETC members, you all can recommend additional members that could be added to the group that would bring unique and necessary and needed expertise and perspectives to the discussions. You would make those recommendations to us, and we would facilitate outreach and onboard and presenting those recommendations to you all. And then there are some state agency liaisons that you've already met that will contribute as needed. So Cindy, we won't share the draft charter today, but we'll share it soon as our committee moves forward. We tried to simplify things for you all in this first meeting with a lot of information and condense it just to slides, but that will be coming, and you all will have the opportunity to review the full draft charter. So let's look at membership a little bit more detail. So current membership member categories and some of the representation that we see in our committee, and we would appreciate your feedback on our current membership and what you would think could be missing, or recommendations for potential rural provider committee members. So some of the categories we see are those rural providers, both the clinicians, but also those that are running health systems and running hospitals and clinics and a variety of healthcare professionals. Second group are those that are technology and AI subject matter experts and expertise in AI in those digital health solutions. Another member group that we see are those representatives that have expertise in research and evaluation and public health and policy analysis, and the intersection of this work with those broader questions and areas of investigation. The last member category group are those state agency liaisons, and we have designees from KDHE and other relevant agencies that will be involved in the work. So pause here. Any discussion or any comments on that? I hope folks are adding to Padlet, but invite folks to come off mute or add in chat about current membership and who's involved in the committee. Any feedback that folks want to share live?
You know, the only thing I would add, Wyatt, and I really liked Janet's comment in there about the provider and participation. I think, and it may be represented because you have some strong CIO representation here, but someone that's done implementations, okay, really has done the hard work on site with providers, whether it's in behavioral health or traditional, ambulatory acute care. Just somebody that brings in the trenches implementation experience. And again, there sounds like when there's some great people on this already, they may have like, hey, I do that every day, so we might be cool there. But I think so much, I said earlier, I have a lot of focus on implementation and sustainability. So I think maybe just assessing our own skill set first to see if we have that in the group. And if not, maybe consider an addition of someone that's done implementations.
Thanks for that feedback and comment, Dick. And I'll flag later. We will invite you all to self-identify some of the expertise you all think you bring to this work in our registration survey, and that will help us understand some of that expertise. But thanks for that comment. Seeing one in chat from Tatiana, consider adding ethicist to the group. Thanks for that comment, Tatiana. Any other comments on maybe what perspectives are missing, what could be enhanced in terms of a range of expertises?
This is Janet. I'll just go off that instead of putting it in a tablet. But as this evolves, I don't think it hurts to consider a patient trial, patient input, depending on where we go with this. And even, we talk about telehealth and all of it. A lot of people don't want to do that. And, as depending on where we land with the technologies, just consider an ad hoc consultation with some patient pilot groups or something might be something to think about.
Thanks so much, Secretary. I'll jump in there. Yeah, we anticipated that a little bit, and we had consulted at least with KHA, and there is potential to use patient advisory committees through hospitals that are kind of designated for that purpose across the state already. And so we could use that as a kind of an established groups across the state, and they could assist us in getting that perspective to the committee if that's of interest to folks. But we can also identify other ways too.
Sounds good.
Thank you both. Any additional thoughts? It's a really important piece of this work, so don't want to rush any comments or thoughts.
We also really are looking for additional recommendations for providers with rural experience to serve on the committee. Thanks so much to Dr. Gauze for his participation, but if you all have connections or know anyone, that is something that we're still actively recruiting for. So if you have any suggestions, please send them my way.
Thank you, Sheena. Well, I will move us forward to another piece of our charter. But if have additional thoughts, please share them. So another element that want to share, terms and expectations. So what are you all committing to do and bring to this work, and how are you going to show up? So some core expectations. You all will attend majority of meetings, be active participants. You've demonstrated that really well today, so thanks for all the engagement. You'll show up prepared. As we move forward, there will be resources that we share in advance of meetings. There will be things that we ask you to review to come prepared so we can really maximize our time. So that is an expectation for the group that is in the charter. Talked about participation, actively engage. Important piece, especially given the role that vendors and technology recommendations will play, is a conflict of interest disclosure. So we will facilitate that and wanted that noted in the charter. Confidentiality, members are expected to maintain sensitivity around information shared. And then the final piece, terms and rotation. Policies will be determined by the ETC in the year 2 work plan. So the exact terms and how long people are on the committee and how they will rotate out is one of the things that you all will collectively decide and propose in the work plan. Another piece that we have identified in the charter for you all to respond to and give your feedback on is some of the leadership elements of how you all will work with each other and take some responsibility and leadership in different aspects of the work. So a couple key roles that are volunteer-based that in our registration survey, we will ask for your interest and willingness in being considered for these roles. One role is a section lead. This individual or these individuals will be assigned and take some responsibility for specific written sections of some of the deliverables. And so you will be the point person. You will ensure that that work is continuing to move forward, and you will really bring your expertise to that component of the work. You will be supported by the whole committee. Everyone's contributing, but another key role is those content reviewers. And similar to section leads, maybe specific sections or specific components of deliverables, but you would be in a role of responding and reviewing and taking on that role of saying, I will come through and review this in fine detail and ensure that it's accurate, that it's complete, that it's clear. So building in some ownership and leadership for moving some of the work forward. We've proposed and would love feedback on two roles for that: section leads and content reviewers. The other leadership note that we want to acknowledge and point out that's in the charter is those state government liaisons, chief information technology officer or designee, KDHE representatives, and note that those folks are here in advisory capacity, and the decision making, the consensus determination, which we'll talk about next, is the committees. You all are making the decisions. It's your committee. Our role as facilitators to facilitate and support, and similarly with our liaisons. I'll move to the next piece because I started to talk about decision making. So again, please add your feedback into Padlet and add it in chat, or if there is something you want to add a comment, come off mute. So how will you all make decisions? That's an important piece of the charter. Consensus-based process is what is proposed, that you will, whenever possible, operate by consensus. And it's our work as facilitators to create a process that enables that consensus to be reached. And we will use a variety of tools like we are today to help enable that process. We'll collect feedback, we'll have surveys, we'll have things for you to respond to read, to make sure that everyone can be heard in different ways and people can contribute to that. Cindy, know there may be a decision making hard to see, so just scroll over if you're not seeing. So we're towards the later section. So if you're not seeing decision making, try scrolling to the right. And if for some reason you're still not seeing it, feel free to add a comment in chat or wherever, and we'll just say this is for decision making, and we'll get it in the right spot. Another piece on decision making. Ultimately, the recommendations that you all will produce are advisory, and that final decision making on funding and procurement and program administration is still the responsibility of KDHE for the Rural Health Transformation Program. A little bit more on decision making and some of those roles. You all are the decision makers. You're the ones coming to consensus, and you're the ones deliberating and making those recommendations. And everyone else that you see on the table, we're supporting you in various ways. And we've heard from us, our role is to be a facilitator. Our goal is not to guide you in any particular direction, but to facilitate the process for you all to come to the recommendations and the consensus that you would like. KDHE provides overall authority for decision making and program administration. CARE Collaborative is administrative support for the Rural Health Transformation Program, and as you've seen, we'll bring some subject matter expertise. BioSTL has technical subject matter expertise, and will utilize a lot of the information and recommendations that you all put together, and then we have those state liaisons as well. the last bit of discussion or piece that want to talk on charter amendments or charter is charter amendments. So charter is a living document, and there may be desire to make some adjustments to that charter even after we finalize it and approve it here this month. So the process for that will be that you all can identify and propose an amendment, and you would submit that to KHI as facilitators. We would do the work of distributing that and showing how that would show up in the charter, and then you all would review and approve that amendment. So that's the proposed amendment process in the charter right now. And as with everything that I've shared, we want your feedback and your input on the charter. So continue to add those comments in Padlet, but we also, looking at time, we've got about 20 minutes left. We want to use the rest of those 20 minutes to talk about, have some space for questions and discussion, tell you what's coming next. But we also want to give you a few minutes because we all know that you all have a ton of work and a lot on your plate. We want to give you time to pull up and complete, at least start that member registration survey. This survey is really important and helpful for us, and my colleagues are going to drop it in chat here for you as well. It is easy to take on your phone, so if you want to do the QR code as well. So this will give us that contact information. This is also a space for you to tell us about your expertise and the work you do, as well as the people you serve across the state of Kansas. So please complete that survey if you want to take time to do that now as we move forward. That would be great. If you run into a question, you say, I would really want to think about this, you've got until June 16th to complete that. And there my team members both dropped it in. So you can click on it and pull it up on your computer and complete it there. And again, we really appreciate your feedback. We will use that as facilitators to support this work as well. So please be honest and engage in those questions as you have thus far.
Thanks, Wyatt. Yeah, so we'll give you a little bit of time to complete that. But additionally, if you have any other questions that come to mind as people are completing it, or if you want to wait and do it on your own time when you have some time to think about it, we can just have some open Q&A while you're all doing that as well. So it's choose your own adventure time, and let us know. Secretary Stanek. Oh, sorry, she had her hand raised.
Oh, okay. Hey, hi everyone. I've been just thinking here, because we're coming, this is new and we're just coming up, having to present to the State Finance Council and whatnot. And we're very focused on what's coming and what we're going to do to try to launch this. But there are a number of activities going on that are linked to technology that are in motion right now, or could be. For example, all the grants that we've just issued. And I can't pull out anything specifically in my head right now because there's a lot going on. But I wonder, at what point do we just feed this committee that information so they know the technologically related or technology related activities that are going on, or that people are proposing in their grant applications for the capital and partnership grants that we just issued, so you can kind of get a flavor of what's there and how we maybe continue to leverage that. And I'll call on Marty and Matt to help me out with what I'm trying to articulate. Thank you.
Yeah, especially in the area of consumer-facing technology, which is part of Initiative 1. There are technologies to be implemented in this first year, including computerized cognitive behavioral health therapy, Alzheimer's disease and dementia prevention, as well as asynchronous diabetes prevention program. And certainly want this group to be aware of those capabilities, but also help support how to effective implementation in rural communities of those technologies, because there's a disconnect there's a gap we need to fill between having the technology available and actually getting it in the hands of rural residents to be used in an effective manner.
Yeah, I think
And
the
I
only
think
thing I go ahead.
I just think part of it is that this committee isn't in, I don't want to say in control of that, but it is, the gap too exists between what's going on and what you think your role is. We need to marry that up. Go ahead, Matt. I didn't mean to interrupt. Sorry.
I was just gonna say, I think those 2 grants we just awarded last week, some of them do include some technology things for different partners. We can definitely pull those out and share them. But then, as we talked about at the beginning of the call, we do have the Emerging Technology Grant, which is separate from this side of things, but there may be overlap. And so as we roll that grant out and we get those applications back, we can make sure we keep this group informed of what we're doing and what we're seeing, and even the themes of the applications, and see if there's any crossover that may make sense. So I think there's a lot of this application was written, so there's purposely a lot of overlap and we can be successful. And so we'll have to make sure we keep doing our best to feed you guys information as you guys are meeting over the next few months.
Thank you so much. It's definitely something that crossed our mind too. So it's great to hear. And I think also as facilitators, we can help ensure that we're inviting and making space in the meetings for those conversations and information. And also we are planning to do as a team like a crosswalk of all of the activities that were outlined in the application, and we'll coordinate with Marty and others to make sure that we kind of have, kind of a global view of all of the technology related activities that are happening and, various statuses of those as well. So we'll make that available as we're working on the work plan and the budget for year 2 as well. So thank you so much. Appreciate that comment.
I think Robert made a comment earlier about suppliers showing up and saying, you got all this RHTP money, go spend that. I think that's where there is a little bit of confusion, because some states seem to be putting aside pots of money for some of this stuff. And I think Kansas is frankly, a more thoughtful and sustainable approach. And I think it would be helpful. I didn't realize there's all these other pathways to getting technology into the rural health infrastructure. So I think to the degree that maybe that can be presented in I don't want to say consistent, but so we can kind of see what's coming down the pipeline. And I also think part of what we're trying to do is to get those early stage and growth companies that are interested and focused on rural health to understand the rules of the road. Like, here's a pathway in for this in year 2, year 3. Here's a pathway here in, because we're really talking in many cases about the out years to impact, through this group.
Thank you. Chris?
Yeah, I'd support that as well. Getting early understanding and maybe visibility into other moving pieces of technology as a recovering architect. It's always better to have that broader perspective, so that we can be more informed and helping to make a better decision.
Any other thoughts on information or gaps that need to be filled for the committee as we start down the road?
Shane, I think we could create a visual or at least a very short summary that shows that so folks can appreciate all those pieces working together. I say this all the time, but you still tend to think of this program as individual programs when in fact it's a plan and there's different pieces that fit together well, and we need to make sure we are leveraging that to the full extent we can.
Marty, this is Tatiana, and as we create this visual, it might be helpful to indicate which of those pieces are for information purposes and which one is for feedback or opportunity for feedback purposes.
Feedback is always good, anywhere it comes. Yeah, absolutely.
Awesome. All right. Well, any other questions in general before we kind of talk about next steps and actions before the next time we see each other. Okay. All right, Wyatt, I'll turn it back over to you to share the slides.
Thanks, Sheena. So we want to just remind everyone of the upcoming meetings and the schedule. Should have these on your calendar. If you do not, please reach out to us if you have questions, conflicts, concerns. It's our role as facilitators to help facilitate your participation and engagement. So please reach out to us and let us know of anything that's missing. But moving forward, looking what's coming up. Today was a lot about you all getting to know each other, kicking off this work, hearing about your interests, your concerns, things that are priorities, talking about how we will work together, how you all will work together with that charter development. Next meeting, we'll finalize that charter. We'll review all the feedback you gave us and all of our notes, and we'll start the work of further clarifying those challenges and solutions and that initial RFP feedback. After that, in moving into July, as Sheena mentioned, we front-loaded this work. So we've got 2 meetings this month, 2 meetings next month. We are hitting the ground running, as they say. In July, we'll move to technology discussions and finalize that RFP feedback in end of July. Really mark your calendars for this one. We would love as many people as possible to join us in person for our meeting on July 29th. That's a longer meeting, a 4-hour meeting, and a lot will happen. We'll be really make a lot of progress at that meeting and that time together, get a lot of feedback to BioSTL, and really do a lot of work on that work plan and budget that will guide the committee moving forward. After that, we'll shift to monthly meetings for the August through October timeframe, and the timing for those will shift back to early afternoon and just an hour and a half for those, and we'll refine the work that was done thus far and provide project updates. Do that information sharing that we've heard will be really valuable for you all. And by October, we'll finalize that work plan and budget. A note on timing: today we had a morning meeting from 9 to 11, but you'll notice that the rest of our meetings, generally speaking, the time to mark is 1 o'clock. So as much as possible, please clear that time so that you can be fully engaged and do this work. And we appreciate all the discussion and contributions today. So that's what's coming up. A reminder to, if you started but did not finish, please complete that participant survey. And otherwise, we can stop sharing. And any final comments or feedback as we wrap up today, and look forward to a lot of great work that you all will do as a committee. Any final questions?
Right.
Thanks for great facilitation. I'll tell you that. I think this was good. I appreciate it. Well done.
Thanks so much. We're all in this together, so we'll support you however we can to the best of our ability. And when we lack expertise that we think we can outreach to others to find the expertise so that you all can make progress on your work. Thank you so much for trusting with this effort. It was great to meet all of you, and yes, thank you for an engaging discussion, and thank you to our state partners and others who are helping us along the way. So we'll look to see you again later this month, and in between we'll be sending you meeting summaries, the slides, the Padlet, and the draft charter for you to review for next time.
And one thing, just a sort of a logistic thing: if you have a really well functioning firewall on your email, don't forget to check your junk mail, especially for those calendar invitations. It's a friendly reminder to us too. So especially this next month, just double check mark us as trusted senders. But just a reminder to myself and to you all too, we'll be sure to check our junk mail as well, so we don't miss anything from you all.
All right. Well, thanks, and we hope you have a great day.
Thanks, folks. Good to see you.